Raven or Aguilar, third-year optometry student. Ophthalmoplegia, also known as extraocular muscles palsy, it is a paralysis of the extraocular muscles that controls eye movement. There are three cranial nerves involved. First one is the third cranial nerve, oculomotor, the fourth cranial nerve, trochlear, or the sixth cranial nerve, abducens, are usually involved in ophthalmoplegia. In all three cases, defining the symptoms is double vision. The cranial nerve or the muscle that controls the eye are affected in oculomotor paralysis, causing the eye to drift outward, and slightly downward, with difficulty turning inward and outward. Furthermore, the affected eye's upper eyelid usually drops, a condition also known as ptosis. And the pupil arm may be enlarged. A cerebral aneurysm is possible if the pupil is abnormally large. This can be associated in discomfort, trochlear paralysis, which affects another muscle, the superior oblique, results into vertical deviation of the affected limb. So what exactly is cranial nerve palsy? So a palsy is a loss of nerve function. A cranial nerve palsy can result in a partial or total paralysis of the area reserved by the affected nerve. So in this case of cranial nerve with multiple functions such as oculomotor nerve, a palsy can affect all or only some functions of it. So what are the reasons of cranial nerve palsy? So cranial nerve palsy can be caused by numbers of factors. It can be congenital, so which means present at birth, traumatic, or can be a result of blood vessel disease, hypertension, diabetes, stroke, or aneurysm. It could also be caused by infections, migraines, tumors, and high intracranial pressure. So the physician can be directed to the appropriate diagnostic test based on the patient age, medical history, symptoms, and examination. So what are the symptoms of palsy in the cranial nerve? So the fourth, third, and sixth cranial nerve pulses can restrict the eye movement that can cause strabismus. When we say strabismus, it is the misalignment of the eye. And diplopia, or also known as double vision. To compensate their strabismus and reduce the diplopia, the patient with cranial nerve palsy may adopt an abnormal head position. The third nerve palsy can cause ptosis, which means the dopey eyelid, so the eyelids will drop, or mydriasis. In addition, in limited eye movement, an abnormally dilated pupil can occur. So to go back to the topic, what is cranial nerve? So cranial nerves are nerves that lead directly from the brain to the part of the head, face, and trunk. These are 12 pairs of cranial nerves, and some are involved in special senses like the sight, the smell, the hearing, taste, and feeling, while some others control muscles and glands. So, which cranial nerve pertains to the eye? The second cranial nerve is called the optic nerve. It sends visual information from the eye to the brain. The third cranial nerve is called the oculomotor nerve. So it involves the eye movement, eyelid movement, and the function of the pupil and the lens inside of the eye. The fourth cranial nerve is also called the trochlear, and the sixth nerve is the abducens nerve. They each innervate an eye muscle involved in the eye movement. And the fifth cranial nerve is called the trigeminal nerve. It provides the facial touch sensation. So what are the treatment we can use for the patient that has cranial nerve palsy? So please refer to the specific section to fourth, third, or sixth nerve palsies in the specific information recommendation. So some cases may revolve on their own, and ophthalmologists will usually wait at least 6 months for possible spontaneous improvement. During this, double vision can be relieved with prism glasses or patching of one eye. If the palsy is congenital or does not improve after 6 months, the eye muscle surgery may be performed or improve eye alignment and diplopia. And the best treatment will be determined by the ophthalmologist after thorough evaluation. Raven R. Aguilar, third year optometry student.